facilitators are a necessary, I would say, intervention times, but not all facilitation is not 100% mandatory. iElixir is not a facilitator, as has been pointed out to me. It is a search engine portal. So it is a more open source. No, there is a transparency inbuilt into the platform of iElixir. So if there is a facility of direct conversation between the patient and the provider, in this case me, then the platform of iElixir is ideal because there is no third-party intervention in this process. Then I have got all the equipment and facilities. I have got my own website which is listed on iElixir as an hyperlink. So when people go into Elixir, they can actually find and locate my website, and they can correspond directly with me by sending me an email to me or my staff, and they will be assured they will get a response within 24 to 48 hours. I also have the facility of overseas calling. As iElixir offers this platform because it is a search engine portal.
Yes. Now, in terms of follow-up, let's say I have my procedure, you have been my doctor, and you have treated me very well, and I go home and my local physician, I would like my physician to speak with you just to hear your assessment and what you think I should receive in terms of follow-up treatment in my home country. Do you provide that kind of insight? Would you to my doctor?
We always send a detailed discharge summary. This will contain the information about the condition for which the patient really sought treatment here, the operation which was performed, the details of the operation, the time, the method of anesthesia, and the implant which was used, the size of the implant, the make of the implant, and all that. And there will also be instructions of physiotherapy given, what has been done and what is the status when the patient leaves the country. So therefore, it is a continuous process. Usually, the patients do understand what is required of them to go on to get the full function. And if they produce this discharge summary to their doctor, it will be very, very clear to their own doctor what needs to be done. And of course, the doctors can correspond with me through the same channels, direct channels, which are available on my website.
Okay. Now, yes, you have your website, and the question I would have is, do you see, even though it's in its infancy, does iElixir facilitate that kind of dialogue between you and other professionals overseas around quality patient care?
Certainly, iElixir does facilitate that because it has got a list of procedures available, and it has also got a list of facilitators available. So procedures are clearly mentioned, the hospitals are there, and it is a very transparent source. So iElixir would be able to offer patients what they want in terms of whatever be the choice. They can either go through a facilitator, or they can approach a hospital directly, or if they have got insurance companies, they can find out if a certain provider has got a tie-up with an insurance company. Then they can compare pricing of several countries, and therefore it gives them much more options than a single facilitator or hospital could give.
Okay. So as a physician, when you look at iElixir, does it appear to be something that gives you a sense of, we say in the States, does it increase your comfort level being a part of the iElixir environment with respect to security and quality of service in terms of facilitating dialogue between the patient and yourself, well, not so much you directly, but others in your other doctors? I guess what I'm trying to ask very badly is, can it be improved? Now, Dr. Venkat, I'm not trying to put you on the spot at all with this next question, but it has to do with, from your discussion, quality is very important to you. It comes across very clearly that you take what you do very seriously. You are very proud, for lack of a better description, but you value the work that you've done, the study that you have done over time. And what iElixir attempts to do is bring quality doctors like yourself together in an environment where you can help people, not so much Americans, but everyone who has a medical need, come to this platform to begin to open up dialogue, to discover what the best procedure will be for them for whatever it is they need, and the process. Yes. Yes, we certainly do commend the CEO, Ilan, for taking the time to put that together. Is there anything that I have not asked you that you would like to share with the audience?
I think you've covered everything. I have brought out my advantages. You said that Americans particularly may have some downsides, or they may have some apprehensions about coming to India. So in order to reassure the Americans, I would like to bring this point forward. Americans are, until now, Americans were quite happy with the treatment which they were getting in their own country, as you know. But the political systems keep changing, and with the current system, many unhappy Americans are there, and the numbers are coming up day by day. Midterm elections are around the corner, which is, and I'm sure there are going to be tumultuous changes to increase everyone's, I would say, state of discomfort. So what are their options for them? The option is look abroad. But when they look abroad, they find that India is a good option, but it is halfway around the world. So many Americans don't have passport. They are not used to this system of traveling abroad. But when they do that, it is for their well-being. You know, when the aeroplane was discovered, many people had a fear that if they go into the air, they may just drop off and perish. But it was not the case. Air travel is one of the safest now. And therefore, it is a cool experience for them. But they will definitely, once they discover the many benefits that it offers, they will love it. They will love to come. They will love to travel abroad, get a treatment, get savings, and get some tourism inside, see some sights, experience the culture.
Yes. One of the things that we have observed in the United States is introducing this concept, and it's not that corporations, like the very big Fortune 500 companies, it's not like they are not involved, but with all the constraints of unions and insurance and other constraints, how would you suggest things that we might look at to encourage a big company to not only consider iElixir as a portal from which to do the research, but to begin to develop a relationship, if you will, a bridge between the United States and India, so that employees might take advantage of medical tourism in that respect?
Yes, big companies are always looking to cut costs and find easy solutions. In my recent understanding, many companies like McDonald's are not going to offer Obamacare or Medicare, and they've asked to be dropped out of this health insurance plan. Some companies like Caterpillar have already started sourcing their medical treatment via medical tourism. So therefore, here is an opportunity in medical tourism for big companies to actually work or increase their working capital by decreasing costs spent on medical treatment. And when there is a ready-made platform like iElixir, then the big companies can find out what is the best option. They don't have to spend money on travel and time. The solutions are all there, inbuilt inside this platform. And therefore, everybody's information is there. They can directly communicate with these concerned parties, and the whole process would be smoother and faster.
Now, thank you for that. The one question that every American will ask, no matter what it is, whether they're buying a car or thinking of something as critical as their surgery and medical care, the question always comes up, what's my risk? What's the downside risk to me as an American? How would you respond to that question, Dr. Venkat?